When we think about addiction, we often focus on behavior, using too much, using too often, struggling to stop. But at its core, addiction is a brain disorder shaped by neurobiological changes that occur through repeated substance use. And for many people, those changes are compounded by trauma. Trauma physically alters the brain, affecting stress regulation, impulse control, memory, and emotions. When a person who's experienced trauma turns to substances, they're not just making a poor decision. They're trying to manage a brain that's been rewired for survival. Understanding the neurobiological and psychopathological mechanisms behind addiction helps us move beyond the idea that addiction is just about willpower. Instead, we can see addiction as an adaptation, one that may have started as a way to cope, but ultimately hijacks the brain's ability to function in a healthy way. So let's start with talking about how trauma impacts brain structures related to addiction. Trauma and addiction are deeply intertwined at the neurobiological level, influencing key brain regions that regulate stress, decision-making, and reward processing. The three main areas impacted by trauma and later by substance use are the amygdala, the prefrontal cortex, and the dopaminergic system. So the amygdala is our fear and threat detection center. Its job is to scan for danger and activate that fight or flight response when needed. In individuals with trauma, the amygdala becomes hyperactive, meaning that even minor stressors can feel like major threats. This chronic overactivation keeps a person stuck in survival mode, constantly anticipating harm. Now add substance use to the mix. Many substances, particularly depressants like alcohol, opioids, and benzodiazepines, dampen amygdala activity, creating a temporary relief from stress. Over time, the brain learns that substances equal safety. This is why trauma survivors are more likely to develop substance use disorders. They're not just seeking a high, they're seeking nervous system regulation. However, chronic substance use damages the amygdala further, making people even more stress sensitive when they're not using. And this leads to a vicious cycle. Heightened stress leads to substance use, leads to withdrawal-induced stress, leads to more substance use. And moving on to that prefrontal cortex impairment. So remember, the prefrontal cortex is right at the front of our brains, right behind our forehead. And it's responsible for rational thinking, impulse control, and decision-making. It's the part of the brain that sometimes functions as a stoplight, and it tells us, maybe I shouldn't do that, or this doesn't seem like such a good idea, or what are the consequences going to be of this decision? Trauma can impact the prefrontal cortex. And I think it's worth noting that generally adolescents or even adults like up to age 26, their prefrontal cortex isn't always fully developed yet. So if you're thinking, oh, my kid doesn't really ask those questions, it's because their prefrontal cortex isn't totally online yet. But trauma can damage the prefrontal cortex, particularly in people who experience chronic stress from a young age. And this makes it harder to regulate emotions, plan ahead, and resist impulses, which are all key components of addiction. And here's the kicker. Substance use further weakens the prefrontal cortex. Alcohol, cannabis, and opioids suppress prefrontal cortex activity, reducing a person's ability to make good decisions. Stimulants like cocaine and methamphetamine artificially increase dopamine, making impulsive behaviors more likely. The double impact of trauma and substance use on the prefrontal cortex explains why people with addiction often struggle with relapse. Even after detox, their brain's ability to regulate impulses is still compromised, making long-term recovery even more difficult. And at the heart of addiction is the dopaminergic system, which controls reward, pleasure, and motivation. Normally, dopamine reinforces natural rewards like eating, socializing, and accomplishing goals. But substances flood the brain with unnatural levels of dopamine, overwhelming the system. And for trauma survivors, this is particularly dangerous. Chronic trauma can lead to low baseline dopamine levels, meaning that people feel less pleasure from everyday activities. They're more prone to depression or anhedonia, or that lack of motivation or joy. And when they discover substances, the dopamine rush feels more rewarding than anything else ever has. Over time, the brain adapts to these artificially high levels of dopamine, reducing the number of dopamine receptors available. So this means that without substances, nothing feels rewarding. The person needs more of the drug to feel normal, and long-term substance use depletes motivation for anything other than using. And this is why long-term recovery isn't just about stopping drug use. It's about helping the brain relearn how to experience pleasure in a healthy way. And beyond structural changes, trauma and addiction disrupt cognitive and emotional functioning. Many of the thinking patterns and emotional reactions seen in addiction stem from underlying trauma responses. Memory impairments, hyperarousal, and dissociation in people who use substances are all common ways that substance use and trauma disrupt the brain in different ways. So, starting with hyperarousal and memory intrusion, the brain stays in constant survival mode, leading to intrusive thoughts, flashbacks, and overwhelming emotions. And this increases cravings because substances temporarily shut down these traumatic memories. And then there's dissociation and emotional numbing. Some trauma survivors experience dissociation where they feel disconnected from reality or their own body. Substances, particularly opioids, alcohol, and dissociative drugs, reinforce this emotional escape. And then we have blackouts and fragmented memory. And chronic substance use, especially alcohol, can block memory formation, making it harder to recall past actions or consequences. And over time, this reinforces impulsive decision making, making relapses more likely. Because if we don't remember a consequence, it's hard to learn from it. And so let's talk about the role of emotion dysregulation in relapse vulnerability. At the core of both trauma and addiction is emotion dysregulation, the inability to effectively manage emotional states. People with trauma often experience intense mood swings, difficulty identifying or expressing emotions, and a tendency to avoid distressing feelings through numbing or distraction. So you might be wondering, how does this connect to addiction? Well, substances can become a shortcut for emotional regulation. When people stop using, they experience intense emotional dysregulation, and without new coping strategies, they return to substances to manage emotions. And this is why relapse prevention must include emotional regulation strategies, not just abstinence. If a person doesn't learn how to tolerate distress and regulate emotions, their brain will push them back towards the only coping mechanism that it knows: substance use.